Now, how do you fancy getting cancer screening from your local council? Or how about fitness classes aimed at reducing obesity or your flu jab? Well, you might not have heard, but a radical change is about to take place in the way public health is handled. And from April, it's being transferred from the NHS to local authorities, along with millions of pounds to fund it. It's a vital service, but soon programmes like this will be under council control. The FAB scheme in Leicester advises people on healthy eating and exercise to improve their health. At the moment, it's funded by the NHS. From April, it'll be Leicester City Council.
And that's what it's about. It's about recognising what you're already having and what a recommended portion is, and then...
The changes to public health mean an enormous new role for local authorities who'll be looking after a wide range of programmes like cancer screening, sexual health initiatives and helping people give up smoking. In Leicester, the City Council will get £20 million to pay for the programmes. The new man in charge of public health for the city will be Deputy Mayor Rory Palmer.
Now we have the opportunity, I think, to put public health at the centre of more of our wider priorities. So when we talk about transport, we should be much bolder talking about cycling and walking from a health point of view, for example. We should be thinking more about health when we come to assess licensing applications and planning applications for shops and licensed premises, for example. It's an opportunity to make those direct links with other priorities in our communities. And of course, to be leading on public health with a democratic mandate, something of course the NHS didn't have.
Programmes like FAB will continue to run. People on the course will notice little difference, but the council is hoping to have a big impact on the health of everyone in the city.
It's just it's giving me motivation to change. It's giving me the knowledge that I never knew before. Like coming here, I see this plate in front of me, and it's telling me what's good for me, what's not good for me, what I should be having, how many portions.
As we all know, we're getting bigger, and it start off with the children. Teach the mothers, they'll help the children.
So my girlfriend does all the exercise and I look after the kids. So we're hoping to change that where we all exercise together so the kids will join in as well, because then they'll be healthier when they grow up.
I think the big priority here in Leicester is to close the health inequalities gap. If you look at life expectancy figures between the more affluent parts of Leicester and the poorer parts of Leicester, that can be up to 8 years for men and 6 years for women. People living in our more affluent areas can live for 8 years longer than people living in the more deprived parts of the city. I want to see that gap closed.
Well, Nikki, this is a massive change, but the key question here really is, can councils do a better job than the NHS on this?
Well, I think they can, in the sense that I think this shows is that health is not just about the NHS. It feeds in so many other areas. And I think, to be fair, Rory Palmer had a very fair point, which is that councils, they obviously deal with housing, transport, education, all of those areas where we want people to be healthy. So I think, as one of the people on the film talked about her children, actually, if we can get health messages right into the school curriculum, and then we can help people in terms of the way they get to and from work and school. So I do think that councils have a real role to play here.
Cynically, though, are you doing this to cut money, to save money?
No, I don't think. No, we're not. And I think it's all about making sure that actually the messages get through. And I think sometimes people are much more likely to take a health message than from the council. And one of the areas I'm particularly interested in is obviously mental health. And you think about the impact, say, of housing on mental health. Actually, it's much better that the council is overseeing that, and it's just seen as a health problem to be dealt with by the National Health Service.
Chris, Labour's Rory Palmer welcomes this transfer of power, if you like. Do you?
Yeah, I mean, when the government are doing something right, I should say so. I think it is the right thing to localise this public health budget. It's actually also important to prioritise preventative health. So if you can get investment in keeping people well, then they don't go into those more expensive hospital environments later on down the road.
Why do you think it's the right thing, though?
Because I think if you devolve the money to where there is more scrutiny, people can keep account of what's going on with that money, I ultimately think there's a bit more accountability in that local democratic environment. As you say, though, the critical thing will be, have we got the money that was being spent centrally at the same amount, or hopefully more, being devolved locally?
And I guess as well, if the money's there, will that money actually be spent in those particular public health areas, with budgets being squeezed, for councils all over the place, really? How can we guarantee that the money will be spent in public health?
Well, and I think that's up to the public health experts in the council, and no doubt it requires a clear commitment from the councils. There is also, of course, a health health and wellbeing boards set up. So that's made up of councillors and others who will scrutinise exactly how local populations are being kept healthy, which is why public health is so much a part of that. So I think we've got to obviously see how it develops. But
are you confident that it'll work?
Well, I think the other point is about it's not just in silos. I think too much in government, national and local, we say, here's a budget for this, here's a budget for that. Actually, if you've got the councils dealing with adult social care, children's social services, actually then getting their health working together, so you're making the money work better.
Yeah, the difficulty is, though, I think that, of course, we don't want little penny packets ring-fenced all over the place. The problem is, over the lifetime of this Parliament, one local government expert was saying council funding will have cut in half. I mean, 50% cut in that's going to put a lot of pressure on all sorts of services.
Well, on that subject, really, one area that you are concerned about, you've raised actually, haven't you yourself, Chris, about funding. Let's just have a look and see how the figures actually pan out on this one. In the East Midlands, the money is spread between county and city councils. Nottingham gets £87 per head of population. In Nottinghamshire, it's £44. In Leicester, it's £60 per head. In Leicestershire, the figure is £30. In Derby, it's £52 per head. In Derbyshire, it's £45. And Rutland gets the lowest figure of all at £27. Chris, you're concerned about Nottingham's funding per head, but it's actually the highest in the East Midlands, according to those figures.
Well, it's all depending on where you compare it with. I mean, the one figure that wasn't in your list was some of those affluent parts of the country, really wealthy parts, Kensington and Chelsea.
We're looking at the East Midlands,
sure,
aren't we?
but if you look at Kensington and Chelsea, very wealthy central London, they get £130 per head. That's nearly 50% higher per head for public health than Nottingham will be getting. Now, I just don't understand why Jeremy Hunt, as the Health Secretary, has come up with a funding formula which seems to be rewarding wealthy areas where life expectancy is much, much higher.
But Chris, Rutland is pretty prosperous, wouldn't you say? And it's getting £27 per head,
well,
a third of what Nottingham's getting.
This is why there's a lot of confusion in the allocation.
It's complicated.
I think we definitely need to see why across the country there seems to be a pattern of giving the wealthier areas with longer life expectancy more money, when in fact it should be giving those areas where there's more deprivation.
Okay, but the point is,
extra help.
Obviously I'm not going to here to defend Kensington and Chelsea, but I suspect any inner city area there are pockets of deprivation, and it may well be that actually we need to get cleverer about the way the funding is allocated, so that actually it's not just done by city or county boundaries. It's then done by looking at the various wards. So, for example, I'm disappointed that Leicestershire obviously getting less than Leicester. Whilst I probably would think there's more deprivation in Leicester, more of a health need, that doesn't mean there aren't some parts of Leicestershire, and I can think of some wards in my own constituency that really would need that money.
Yeah. Okay.